Well, I can't say this enough, but your smile is very important at this time, but also taking care of your mouth and your teeth are so important, and that's where Delta Dental of Arizona comes in with Dr. Hall, where we see people are not really doing what they need to do to help prevent COVID-19 or to help them get through this cold and flu season, and that starts with the mouth, right, doctor?
That is correct. Our mouths are indispensable. I mean, we need them to smile at each other, talk, have a healthy meal. And your mouth is also the window into your overall health.
Yeah, and I think when people have the mask on, they kind of like break going, well, no one's going to see me. I don't care. I don't really need to take care of this. But let's talk about that because, again, this is a very important time to make sure you have the right dental care.
That's correct. And now that you mention it, I have talked to a lot of patients that they are just out of the groove of their typical lifestyle, whereas they're used to get up, brush their teeth, take a shower, put on makeup. And maybe they're not as motivated to take good care of themselves since they're working from home and they're not interacting with people like they used to and they're wearing a mask. So it's just I'm here to remind everybody to just keep up really good care of your health and especially your oral health.
Yeah, let's talk about some of the diseases that go with not taking care of your oral hygiene.
Right. Well, the big ones are dental decay, where actually your teeth deteriorate. Teeth do not grow back. So if you have what we call cavities, then that needs to be professionally taken care of. And then the other big one is what we call periodontal disease, which is actually an infection in the gums, and it spreads to the bone and causes the bone to shrink around your teeth. And you can have perfectly healthy teeth, but if you don't have perfectly healthy bone, your teeth are going to suffer and they could even fall out.
What causes that?
An infection in the gums, and it's typically because of neglect, not taking good care of yourself. We're just neglecting brushing and flossing and maybe even putting off a trip to the dentist. So we encourage everybody, go see your dentist, every 6 months is what we recommend. Periodontal disease, we also call it the silent disease, meaning that you may not even know what's happening in your mouth until you have it checked out.
Yeah, and again, it's so important to get in there. Things are safe to go to the dentist's office, and that's what you want people to know too. You guys are taking all the precautions, aren't you?
I personally think it is one of the safest places you could possibly go. Infection control, wearing PPE, that is nothing new to dentists. We have been doing that since the early 80s. And we treat every single patient as though they have an infectious disease. Yeah. So I am just covered head to toe every day. We protect our patients, we protect ourselves. And the crazy thing is that only 1% of all the dentists in the United States have actually gotten COVID. So that's telling me that we are doing something right. Yeah. Those are isolated incidences. COVID is not getting passed around in the dental office.
Okay, doctor, how can people find out more information?
We have a wonderful website. It's deltadentalaz.com. And you can find all kinds of valuable information there.
Perfect. Well, doctor, thank you very much for joining us.
Thank you so much.